Hello and welcome to the Federation orientation from the California Peer Run Warm Line. We're going to talk today about the Telehealth Emotional Support Coalition of California and our request for applications. My name is Raina Daniels. I use she and they pronouns. I'm the Associate Director of Outreach and Strategic Partnerships.
My name is Cheryl Cross. I use she and her pronouns, and I'm the Associate Director of Warmline Programs. A little bit about MHASF. We've been around for over 75 years, and we are a peer-run organization, meaning that all of the folks who work at the agency, who run the programs, we identify as having lived experience of mental health challenges. And our mission is to cultivate peer leadership, build community, and advance social justice and mental health. So we do a lot of community-based services, including the Warm Line, which serves the state of California. What is the California Peer Run Warm Line? We are a 24/7, 365 non-emergency response emotional support line. And all of that to say that we are peer counselors who are here to emotionally support all Californians through a variety of different uh, situations, all through the lens of peer recovery. And our framework is based on the values of the peer recovery movement. And so we are called a warm line versus a hot line because we aim to be a support before someone reaches a boiling point. Similar to the graphic we have of a boiling pot, we try to say that if you have support before things overflow, it can be helpful. And that's why we really believe that peer support can prevent crisis and also kind of help support and maintain wellness and advocacy of peers in the community.
If this is the first time that you're hearing about the Warm Line, here's our information for contact. It's 1-855-600-WARM, which is 9276. We have more information on our website, mentalhealthsf.org/peerrunwarmline. We'll have a link to that in the video. We are available 24/7, 365, and you can call, chat, or text us as well.
A little bit about the Warm Line's history. We officially became a Warm Line in July of 2014. It was launched as the San Francisco Warm Line. In 2018, we had to temporarily transition to a volunteer run model. So we lost our source of funding and we ended up needing to lay off quite a bit of our peer team. We've a lot of work and advocacy by folks in the agency, including the Warm Line team. We were able to get written into the state budget and therefore become refunded as of July 2019. And it also allowed us to expand to 24/7, 365 for the state of California. At the height of, or at the beginning of the pandemic in March 2020, we ended up going fully remote and also developed a relationship with the Department of Healthcare Services of California, who helped create the CalHope COVID-19 emotional support line. And after a couple of years of running two different branches of our warm lines, we were able to integrate both the CalHope and the California warm line together in July of 2022. And so today we currently have full-time staff. We've expanded training. We've really revamped and realigned our programs and practices to our values, as well as started to build on networking with more warm lines across the country. This is the list of our warm line values, and these really guide both our day-to-day work as well as the work that we do with each other and our communication with each other. And so while we won't go through each of them and the definitions of each, you can visit our website for more information of what each value looks like and how we incorporate those into the work that we do. This is a bit of a snapshot of our warm line training. And again, our values really impact what these look like and how we use those on the warm line. And so again, I won't go through all of the things that are listed here, but just know that this is just a snapshot of some of the various topics and goals that we have within our training when getting peer counselors prepared to support our callers on the warm line. And so what can callers expect from us when we call a warm line? The reality is that most callers don't need crisis support and often contact warm lines first, if not exclusively. And that's because we often remind folks that you don't need to be in crisis to reach out, but also if you are in crisis, that's okay. We don't have any particular motivation. There's no private motivations, there's no other goals that we have or agendas. Our goal is really just to show up and be as supportive as we can to the folks reaching out to the warm line. And with other services such as 988, they potentially have policies that involve connecting folks to emergency response services without caller's consent, and that's not something that we do. So the warm line will never call or enact a non-consensual act of rescue unless the caller says that it's okay, that they want emergency services. And with that, our goal is really to empower callers to identify what they need most in that moment and to advocate for what they need.
Now that you have an overview of what the warm lines do, I can share that we share many of these practices with warm lines all over the country. You can find more information about warm lines in other states at warmline.org. It's a directory of warm lines by state. And we have also formed a national coalition of peer-run warm line leaders. This is a community of practice. It's a monthly meeting between the leaders of warm lines from all over the country, representing warm lines that are both statewide and local. We were invited from the California Peer Run Warm Line to the SAMHSA Technical Experts Panel, which produced a report in 2023. We've also presented at places like Peerpocalypse, the NAPS conference, and CrisisCon. I'll now share why we have initiated this project for the Telehealth Emotional Support Network. We, through our own needs assessment and community partners, realized that there was a lot of stigma and discrimination regarding the purpose of and the foundations of peer support programs. We really wanted to increase the understanding of peer-run warm lines and linkage to peer support from other elements of the coordinated care system. We also are looking to provide technical assistance and capacity building for partners, specifically for ethnically and culturally specific programs that provide either peer support or emotional support by phone and their interventions that they've developed. We, as Cheryl mentioned, began the CalHope COVID-19 emotional support line at the beginning of the pandemic. And that project has continued to expand to reach other culturally specific partners, and also to provide a statewide warm line linkage for folks who maybe otherwise did not have exposure to warm line programs. We've realized that that CalHope program has had a broader reach into other emotional support, and we want to make sure that our partners across the mental health system are familiar with that resource. So we began wondering, what would it look like to form a California warm line network? We were familiar with so many other organizations, community-based organizations doing great work in the mental health service field, many of which who had either projects that delivered services by phone or peer support delivered services that were interested in expanding their resources to folks with a lower barrier option. This project is two-pronged. So this much broader umbrella of the Telehealth Emotional Support Network, the purpose is to form an ecosystem of telehealth emotional support programs. And so we're looking at information and referral programs, helplines, intake lines, crisis lines, and hoping that this broader emotional support network that we form all together can be helpful for exchanging referral information, training tools, marketing tools, and resources between us. We are looking at the more niche Warmline Federation as being programs that are looking to develop or enhance their peer-delivered services by phone, or provide technical assistance and training to develop emotional support programs from those that are hosting folks with lived experience, or folks who are providing emotional support without peer values in play, and provide technical assistance to those programs to develop them into peer programs. We also want to form a community of practice that mirrors that we have access to in the national network. increase operations of those programs that just currently do not have the infrastructure or capacity to serve the communities that they are attempting to serve. And again, develop some warm transfer, interoperability, and network development so that we can exchange calls, callers, open hours, and expand those services to better reach the state of California. In addition, there's a lack of white papers, research, well-funded research and advocacy in our sector. We would really love to expand our capacity and the capacity of our partner programs to partner on white papers, research, and advocacy. We anticipate that membership in the support network will include quarterly meetings, resource and referral information sharing, and collaborative leadership. Sorry for the typo. We have expanded our sense of who could be at this broad table to include information on referral helplines, 211, disaster distress, domestic violence and sexual assault programs, intake lines, including housing, county crisis lines, substance use treatment programs, as well as our partners at NAMI and their support lines. If you're doing telehealth emotional support work, we would really love to welcome you into this project together with us. The initial members outlined here have signed into a memorandum of understanding regarding this partnership project. The CalHope Red Line, the MHACC program, Code Tenderloin Project Return Peer Support Network, Blackline, and Peer Voices of Orange County are all partners that we are working with around a needs assessment and establishing what our relationship can look like. We have also oriented folks from the Institute on Aging, Friendship Line, California Youth Crisis Line, Dee Hirsch's programs, the Anti-Police Terror Project, Trans Lifeline, and Hug Space, the Ukrainian Warm Line. We're looking forward to reaching more partners through this RFA process. And if you see your organization's name listed here and you're interested in exploring more options for an MOU or agreement, or wondering about how to re-engage, please do reach out. The Federation Project, which will be limited again to these peer delivered programs or programs looking specifically to expand their services to include peer value, will include MOU and introductory agreements, monthly meetings, an annual summit, and some additional technical assistance and development funding. Our overarching goal is to build a strong network to ensure comprehensive care. We believe that we can enhance accessibility and reach for warm lines, building collaborative partners, and increasing funding for all peer-run warm lines. The Q&A section of this presentation is meant to cover some of those questions that have already been asked by other community partners in writing. And so we'll address the MOU timeline currently is on a rolling basis. You'll see that information outlined in the RFA. If a partner has specific restrictions regarding their ability to engage, please do reach out to us with specific questions. The time and staff commitment, our overview is that this can be tailored to an organization's capacity, and that our obligation attached to each organization's participation can again be very bespoke. Please reach out if you have questions or limitations on your commitment, but we are asking that for the meetings, for the quarterly meetings, for the support network, or for the monthly meetings for Federation partners, that there be a specifically designated staff and a alternate staff available for those meetings in Zoom. And that I realize now that this question and the answer doesn't specifically speak to that, we are providing a small amount of funding to cover each partner's participation hours. And so that information is included in the RFA as well. And communications will be held online. We'll establish with Federation partners what the best mode for group communications are, whether that looks like a group a group chat or some other platform for Q&A and technical assistance support. Please feel free to get in touch with me. My email is raina@mentalhealthsf.org. You can learn more about MHASF there at our website. And again, the link to the Federation request for applications is on our site under programs and under the Federation project. Thank you so much for your time reviewing this slideshow. Again, please reach out, and we look forward to hearing from you soon.